After reviewing concepts of respiratory system, let us proceed to the respiratory disorders and their pathophysiology. Coughs and cold. First, we will discuss the cough reflex. Coughing is an important reflex that helps protect our airways and lungs from fumes, dust, smoke, pollen, medication, or having a lung disease like asthma or COPD. The following factors mentioned activates the cough reflex. Our throat and airways are equipped with cough receptors as well as thin layer of mucus that coats and protect our airways. Now, let us discuss more about the cough receptors. So, pupunta na tayo sa question na, bakit nga ba tayo umuubo? When we inhale a trigger, such as the following mentioned factors, like dust, our cough receptors recognize this intruder or foreign substance. Then, the intruder will be stuck in the mucus lining of our airways. The cough receptors send a message to our brain, and the brain signals back to the muscles of our chest wall and abdomen to rapidly and forcefully take a deep breath in and out to remove the trigger. That is actually the reason kung bakit tayo umuubo. And yung occasional cough na nararanasan natin is normal and healthy function ng ating body. Nagiging unhealthy lang kapag persistent cough. Persistent cough doesn't go away and hindi siya normal. We categorize coughing based on the duration. For the acute cough, it is less than 3 weeks, which has two main subcategories such as infection and non-infection. The most common cause of acute cough is infectious, and dito tayo mag-focus. So, quite commonly, it is the common cold. Kaya nga, di ba, cough and cold. Now, let us discuss the common cold thoroughly. Common cold is generally a mild and self-limiting viral infection of the upper respiratory tract. Viral infection siya kasi nga, as we mentioned earlier, it is infectious. And infection of the upper respiratory tract kasi it mainly affects our nose and throat. There are more than 200 viruses that can cause common cold, and most cases are caused by rhinoviruses and coronaviruses, accounting from 30 to 50% of all cases and 10 to 15% of all cases respectively. May mga other causative agents pa tayo such as influenza virus, para-influenza viruses, adenoviruses, respiratory syncytial virus. Syncytial virus. The general mode of transmission ng common cold ay aerosols and direct contact. For the aerosols, the virus can be aerosolized and go out in the air in large and small droplets. For the direct contact naman, when we say direct contact, there is an occurrence of skin-to-skin contact. For instance, the common cold can be transmitted through handshakes because the virus can get onto the hands. For the pathogenesis, pathogenic events of the common cold caused by the rhinovirus begin when a small dose of virus is deposited into the nose or into the eyes, either by direct contact or aerosol transmission. Kasi yung virus, it usually enters to our eyes and nose. How does these viruses do their damage? Mucociliary action transport the virus to the adenoid, where the virus is able to attach to the intracellular adhesion molecule or ECAM receptors on the epithelial cells. So, let us discuss further kung ano nga ba yung ibig sabihin ng paragraph na yun. Yung mucociliary action, yan yung nabanggit natin kanina sa cough reflex. So, yung action na yun is yung movement ng mucus para mapropel or alisin yung trapped particles or yung intruders. So, dahil inaalis ng body natin yung particles, napupunta siya sa adenoid part. Ito, adenoid. Then, yung virus is mag-a-attach sa receptors ng lymphoepithelial cells ng adenoid. Ito na yung attachment. And that receptor is called the intracellular adhesion molecule or the ECAM. There, the virus begins to replicate, triggering the release of inflammatory mediators, including histamines, kinins, prostaglandins, and several interleukins. So, yung release kasi ng inflammatory mediators ay reaction ng body natin sa presence ng virus. Yung immune system natin, it opens up blood vessels inside our nose through inflammation and it also increases the mucus. So, nagkakameron ng runny nose and stuffy feeling. And it also causes sneezing dahil dun sa irritation na kinos nung virus. And eventually, yung lungs natin is mag-i-start na rin mag-produce ng mucus. And yun yung reason kung bakit tayo umuubo. Kasi yung lungs natin nga, nag-i-start na rin mag-produce ng mucus. The clinical features of the common cold are rhinorrhea or yan yung runny nose, nasal decongestion or yung stuffy feeling, sore throat, headache, stimulation of cough and sneezing reflexes. So for the symptoms, once the viral contact has been made, individuals may begin to notice a scratchy throat 1 to 2 days after contact. A sore throat followed by a thin, watery discharge known as rhinorrhea and sneezing. Within 1 to 2 days, the thin, watery discharge may become thick and purulent. A dry, non-productive cough may develop between days 3 and 5 of 10 evolving into productive cough. So for the treatment, the pharmacist may recommend self-treatment for the following conditions such as rhinorrhea, congestion, cough, headache, and sore throat. Let's move to the allergic rhinitis. Rhinitis is an inflammation of nasal membranes characterized by the 4 cardinal symptoms such as nasal congestion, rhinorrhea, sneezing, and nasal itching. In short, it is the nasal inflammation kasi from the word rhin, which is nose, and itis, which mean inflammation. So, nasal inflammation or nose inflammation. Risk factors for allergic rhinitis. First, family history of atopy. First, let us define what is atopy means. Atopy refers to the genetic tendency to develop allergic diseases such as allergic rhinitis. So, if may allergic rhinitis yung parents mo, malaki ang possibility na meron ka nun or ma-develop mo siya over time. Next is higher socio-economic class. There are studies in the association of social class and allergic rhinitis. Mas common raw yung allergic rhinitis sa mga higher socio-economic class. Next is exposure to indoor allergen. Yung mga indoor allergen natin such as animals or dust mites. Lastly is the positive allergy skin prick test. Yung skin prick test kasi or the SPT is a diagnostic test to detect allergic reactions katulad ng allergic rhinitis. So, kinakandak to para malaman yung allergic sensitivity ng isang patient. So, next, for the classification, allergic rhinitis may be classified as seasonal, perennial, episodic, or occupational. Seasonal and perennial or combination of the two are the most frequent classifications. So, we will explain further yung mga most frequent classification lang ng AR or allergic rhinitis. When we say seasonal, it only occurs times of the year. For example, spring. Di ba kapag spring, diyan nag-grow yung plant and trees or nagbo-bloom. So, madaming pollen sa environment natin. If seasonal lang yung allergic rhinitis mo, it will usually happen kapag spring dahil dun sa mga pollens ng plant and trees. Kapag perennial naman, it happens all the year. Wala siyang pinipiling season or occurrence. So for here naman, it's either caused by dust, pets, industrial fumes, which is laging present sa environment natin. Kaya nga 'di ba, it happens all the year. And lastly, for the combination of seasonal and perennial, symptoms persist throughout the year with seasonal exacerbations. So, meaning, nangyayari siya throughout the year and mas lumalala kapag seasonal. Or, for example, mas lumalala siya kapag spring. Ganon. So, next. Let's proceed naman sa etiology of the AR or the triggers kung bakit nga ba nangyayari yung allergic rhinitis sa isang tao. There are 5 main triggers for allergic rhinitis such as pollens, molds, dust mites, animal allergens, and insect allergens. So, the seasonal allergic rhinitis is typically caused by pollens and molds, while the perennial allergic rhinitis is typically caused by dust mites, molds, and animal allergens. So, let's move naman sa pathogenesis, sa early response. Patients become sensitized to allergens on subsequent exposure. The allergens trigger a genetically predetermined immune response that results in the symptoms of allergic rhinitis. Allergic rhinitis may be then characterized by early or late response. So, uunahin muna nating i-discuss yung early response and i-explain natin siya in a detailed discussion. Let's imagine that a person with allergic rhinitis have been exposed with pollen or nagkameron ng pollen exposure. The pollen will be picked up by a dendritic cell, which is a type of immune cell that gobbles up foreign particle. So, ang function nila is pinaprocess nila yung particle, then ipipresent nila dun sa T-cells natin. The T-cells then become activated kasi nga, di ba, nagpresent sa kanya yung dendritic cell. And magpuproduce siya ng cytokines. And yung T-cells natin, i-activate niya rin or it helps to activate the B cells. So yung B cells, it is responsible for producing the IgE antibody or the immunoglobulin E. And it will be released in our bloodstream. Kapag nasa bloodstream na natin yung IgE antibodies, magbabind or mag-a-attach yun sa mast cells. Kapag nag-attach na yung IgE antibodies, nagiging primed. Sulat lang natin, primed. Yung mast cells, meaning if may nag-enter ulit na pollen or may re-exposure, they will release their histamine in the local tissue. After the release of histamine, kasi nga diba, nag-release na yung mast cells ng histamine. It will dilate blood capillaries and it will become leaky. Thus, magkakaroon ng more fluid and immune cells sa area kung saan nag-release yung histamine. So, dahil doon, magkakaroon ng increased vascular permeability, mucosal edema, watery rhinorrhea, nasal decongestion, nasal itch, and sneezing. And yung sensory nerves natin ay nai-stimulate rin, causing nasal itch and sneezing. Kaya pansin nyo, for people with AR, bahing sila ng bahing and namumula yung ilong nila. So dahil eyes and nose natin ay portal or possible passage for infection, there is a lot of mast cells for extra protection. And that is the reason why our eyes and nose are primarily affected in the AR response. Yung kanina, it's the early response. Yun yung response na nag-o-occur within the minutes or of exposure. So, kapag na pollen exposure after minutes, kung ano yung magiging response, yun yung early response. While etong late response, nag-o-occur to after 4 to 8 hours of allergen exposure. Mast cell-derived mediators led to migration and activation of eosinophils, neutrophils, and basophils, T lymphocytes, and macrophages within the nasal mucosa. And yung mga cells na yun is na-activate after 4 to 8 hours na nagkakos ng reoccurrence of initial symptoms, mainly yung nasal decongestion or congestion. And next is the clinical features of the allergic rhinitis. The 4 classic symptoms of allergic rhinitis include rhinorrhea, nasal decongestion, sneezing, and nasal pruritus. So, familiar naman kayo sa mga symptoms na yan except dito. When we say pruritus kasi or pruritus, it is the itchiness or makati. So, nasal itchiness. So, di ba na-discuss naman natin na nagkukos nga siya ng sensory stimulation kaya kumakati yung ilong natin. That's all for the cough and cold and allergic rhinitis.
So let's go now to the bronchospastic diseases under the respiratory disorder, which are asthma and COPD, or what we call chronic obstructive pulmonary disease. So asthma is a condition in which your airways narrow or sumikip and swell or namaga, and it may produce mucus or phlegma in Tagalog. So this can make breathing difficult and trigger coughing, a whistling sound, wheezing. Yung wheezing is paghingal. So paghingal na sound when you breathe out, and shortness of breath. So asthma can be cured but its symptoms can be controlled. As asthmatic patient, I have experienced this because my doctor said the di daw talaga gumagaling yung mga asthmatic patient, but yung symptoms niya is nababawasan or pwedeng makontrol. Next. So in this slide, you will see the signs and symptoms of the asthma. So shortness of breath, chest tightness or pain, wheezing when exhaling. So kanina yung wheezing is pag hingal, which is yung yan, pag gumanon ka. So, trouble sleeping caused by shortness of breath, coughing, or wheezing. Pag nahirap ka na makatulog kasi hinihingal ka or pwede kang ay inuubo ka. So, coughing or wheezing attacks that are worsened by a respiratory virus such as a cold or the flu. So, next. So, in this slide, makikita nyo siya yung signs na yung asthma nyo is naging worse na siya. So, asthma signs and symptoms that are more frequent and bothersome. So, kanina yun sa signs and symptoms is parang mas ano na siya, frequent, yung lagi nang nangyayari, always na siyang nangyayari, like yung wheezing, shortness of breath, chest pain, mararamdaman mo siya frequent. So, increasing difficulty breathing as measured with a device used to check how well your lungs are working, peak flow meter. So, yung peak flow meter, yan yung parang siya yung sumusukat if meron kang asthma. So if greater than 80% of 100%, ibig sabihin nun may tendency na yung asthma mo is lumalala na siya, pag na-measure na nung peak flow meter. So, the need to use a quick relief inhaler more often. So, yung pag lagi mo nang ginagamit yung inhaler mo, so yung signs ng asthma is nagiging worse na yung asthma mo. So, next. So, in this slide, the picture you will see the difference of the normal to asthmatic lungs. So, in the normal lung, the muscle is relaxed, normal lining and normal amount of mucus. So ayun, yung makikita niyo sa picture niya is yung normal yung lining. So yung muscle niya is naka-relax lang. Then normal amount of mucus lang dun sa normal lung. So in the asthmatic lung, yung muscle niya is tightened or naka-contract. So mahirapan ka talagang huminga. So swollen lining, namamaga yung lining dun sa lung mo. Then excess mucus mo, maraming plema dun sa lungs mo. So next. So in this slides, makita nyo yung pathophysiology ng asthma. So as noted in the definition of asthma, airway inflammation involves an interaction of many cell types and multiple mediators with the airways that eventually result in the characteristic pathophysiological features of the disease. So bronchial inflammation and airflow limitation that result in recurrent episodes of cough, wheeze, and shortness of breath. So pag nagkaroon na ng pamamaga dun sa bronchioles mo, yung airflow doon is malilimitahan na. So magkakaroon ka na ng pag-ubo. So pwede ka na rin hingalin and magkakaroon ka na ng shortness of breath. So next. So asthma involves many pathophysiologic factors including bronchial inflammation with airway constriction and resistance that manifests as episodes of coughing, shortness of breath, and wheezing. So asthma can affect the trachea, bronchi, and bronchioles. Inflammation can exist even though obvious signs and symptoms of asthma may not always occur. So yun nga, naaapektuhan niya yung trachea, bronchi, and bronchioles. So yung pamamaga can occur even though the signs and symptoms of asthma may not always present. So next. So defined as sharp contraction of bronchial smooth muscle, bronchospasm causes the airways to narrow. Edema from microvascular leakage contributes to airway narrowing. Airway capillaries may dilate and leak, increasing secretion which turn causes edema and impairs mucus clearance. So yung bronchospasm causes to airways to narrow or kumikitid siya. So yung edema from microvascular leakage contributes. Kaya kumikitid yung airways niya. Yung edema kasi nakakapag-increase siya ng reduction ng blood flow kaya nagkakaroon ng leakage or kumikitid yung airways natin dun sa lungs. So next. So we are done to the asthma. So let's go now to the last bronchospastic disease, which is the COPD or chronic obstructive pulmonary disease. So chronic pulmonary disease or COPD is a chronic inflammatory lung disease that causes obstructed airflow from the lungs. So obstructed from the word itself, parang may nagbablock dun sa airway ng lungs mo kaya hindi ka makahinga, nagkakaroon ka ng shortness of breath and nagkakaroon ka ng bigla kang hinihingal. Ayun. So symptoms include breathing difficulty, cough, mucus or sputum, production and wheezing, is a typical cause by long-term exposure to irritating gas or particulate matter, most often from cigarette smoke. So pag may nag-i-smoke sa harapan mo or may naninigarilyo, mas prone yung second smoker kasi nai-inhale natin yung smoke galing from the dun sa sigarilyo na ini-inhale ng mga first smoker. So pwede tayong magkaroon ng COPD dun. So next. So people with COPD are at increase of developing heart disease, lung cancer, and a variety of other conditions. So chronic bronchitis is inflammation of the lining of the bronchial tubes which carry air to and form the air sacs alveoli of the lungs. It's characterized by daily cough and mucus sputum production. So pag nagkaroon ka na ng COPD or chronic obstructive pulmonary disease, um yung lining nung sa bronchial tubes mo is napatungan na ng plema. So once na nag-cough ka, pwede mo na nababawasan na nalalabas mo yung mga mucus dun sa airway mo or dun sa air sacs na what we call alveoli. So next. So in this picture, you will notice that the healthy lung, yung difference ng healthy lung and the bronchial ay yung may COPD na lang. So the healthy lung, the bronchial tubes are clear and inflammation free. So walang pamamaga dun sa normal lung. So oxygen more through the air sacs walls in the blood. So yung oxygen is nakakadaloy ng maayos dun sa lungs na normal. So while dun sa lung na may COPD, the bronchial tubes become inflamed. So namaga yung sa bronchial tubes mo kaya nagkakaroon ka ng hinihingal ka or nagkakaroon ka inuubo ka. So narrowed o yun kaya sumisikip. So thick mucus form causing a chronic cough. So parang dito sa thick mucus kasi once na yung patient is may COPD, yung thick mucus niya, yung airway dun is nababalutan na siya ng thick mucus or yung plema, hindi mo na masyadong mailabas kaya nagkakaroon ka na talaga ng shortness of breath. Kaya namamaga rin yung bronchial tubes mo and sumisikip. So next. So now, let's go to the pathophysiology of COPD. So COPD is an inflammatory condition involving the airways, lung parenchyma, and pulmonary vasculature. The process is thought to involve oxidative stress and protease-antiprotease imbalances. So emphysema describes one of the structural change seen in COPD where there is destruction of the alveolar air sacs, gas exchanging surface of the lungs leading to obstructive physiology. So emphysema, it is a lung condition that causes shortness of breath in people with emphysema. The air sacs in the lungs or yung alveoli niya is na damage, and yung leading to obstructive physiology, obstructive from the word itself, may nagbablock talaga dun sa alveoli mo or dun sa air sacs kaya nahihirapan ka ring huminga. So next. So alpha-1 antitrypsin deficiency or what we call AAT is a rare cause of emphysema which involves a lack of antiproteases, protease, and imbalance leaves the lung parenchyma at risk for protease-mediated damage. So yung alpha-1 antitrypsin is enzyme. It is a deficiency or condition that can inherit. So napapasa siya. Pwede siya na inherited siya. So it can increase the risk of lung and liver disease. So the inflammatory response and obstruction of the airways causes the decrease in the forced expiratory volume or FEV1, and tissue destruction leads to airflow limitation and impaired gas exchange. So next, so hyperinflation of the lungs is often seen on imaging studies and occurs due to air trapping from airway collapse during exhalation. The inability to fully exhale also causes elevation in carbon dioxide levels. So hyper um, hyperinflammation, or what we call hyperinflated lungs, are larger than the normal lungs as a result of trapped air. So yung kaya na nakikita siya 'pag once na nagpa-X-ray ka, people with COPD, 'pag nagpa-X-ray sila, yung lungs nila is mas malaki kaysa sa normal lungs na walang COPD na patient. So as the disease progresses, impairment of gas exchange is often seen. The reduction in ventilation or increase in the physiologic dead space leads to carbon dioxide retention. So kaya lumalaki yung lungs ng may COPD na patient is because yung air doon, or yung carbon dioxide is nai-stay lang siya doon, kaya kaya lumalaki nag-e-expand yung lungs ng taong may COPD.
Let's now move on to emphysema. Emphysema is a long-term progressive disease that gradually damage the air sacs in the lungs or the alveoli, causing shortness of breath. In emphysematous lungs, the elastic fibers are damaged. When air enters, the alveolus stretch but are unable to recoil, trapping oiled air, leaving no room for fresh one. Some alveoli may burst, creating one larger air sac that reduces the surface area available for gas exchange. Bronchioles become inflamed and scarred, leaving a narrowed lumen. Symptoms in early stages. First is light breathlessness in early stages and chronic cough, blue skin coloration, difficulty in breathing or shortness of breath, wheezing, pursed lip breathing, or the person pursed their lips, leaving only small opening, then block the airflow when exhale, increasing the pressure to the collapse airways, opening them, and allowing the trapped air to empty. Then develop barrier chest, distance from the chest to the back, normally less than the distance side to side. There are two main causes of emphysema. First is cigarette. Cigarette smoking is the most dangerous behavior that causes development of emphysema. Smoke causes mucus secretion to increase, decreased ability to clear secretion. Mucus that builds up traps bacteria and other irritants causing infections. Immune system releases destructively enzymes, leads to loss of protein responsible for keeping the lungs elastic. Alpha-1 antitrypsin deficiency causes inability to fight destructive effects of trypsin when released in the lungs. Lung tissues is slowly destroyed and decreasing the ability to the lungs to perform appropriately. And last is air pollution. Air pollution acts similar to cigarette smoking, causing inflammation in the airways, leading to tissue destructions. Treatment and prevention, lifestyle, and home remedies. First, you really need to stop smoking. Avoid other respiratory irritants. Exercise regularly. Protect yourself from cold air. And prevent respiratory infection by getting flu and pneumonia vaccinations. Let's now move on to chronic bronchitis. Chronic bronchitis is an inflammation of the lining of the bronchial tubes that results in excessive secretion of mucus into the tubes, leading to tissue swelling that can narrow or close off bronchial tubes. People with chronic bronchitis will eventually develop emphysema. Bronchitis can either be acute or chronic. Acute bronchitis is caused by a viral or bacterial infection and it is usually a short-term illness. Chronic bronchitis results from irritation of the lining of the bronchi and bronchioles by dust, fumes, atmospheric pollution, and most significantly, tars in tobacco smoke. Chronic bronchitis causes excessive amounts of sticky mucus to build up in the airways, restricting amount of airflow in and out of the lungs, results to breathing difficulties. Symptoms of bronchitis: inflammation of the mucous membranes of airways, excessive production of mucus from the goblet cells, damage to the cilia of epithelium, accumulation of the mucus in the lungs, heavy cough, build up scar tissues on the bronchi and bronchioles, infections such as pneumonia caused by bacterial accumulation. Sputum production. The sputum may be yellow, green, or white. Shortness of breath gradually increases with disease severity. Wheezing. A whistling sound produced when airways are partially obstructed. Other symptoms are fatigue, sore throat, and nasal congestion. Causes of chronic bronchitis. The main causes is cigarette smoking, secondhand smoke, inhaled irritants such as smog, industrial pollutants and solvent, viral and bacterial infections, underlying diseases processed such as asthma and cystic fibrosis. Treatment and prevention lifestyle remedies, breathing in warm, moist air to ease cough and loosen the mucus in the airways. Quit smoking immediately. Physical activity to strengthen the muscles and help breathing. Not smoking and avoid secondhand smoke. Flu and pneumococcal vaccines to prevent repeated infections. Avoiding airborne chemicals, dust with appropriate mask. Pathophysiology of chronic bronchitis and emphysema. Too much inhalation of tobacco smoke and air pollution can have continual bronchial irritation and inflammation that can cause chronic bronchitis, bronchial edema, hypersecretion of mucus, chronic cough, bronchospasm, and having a symptoms of airway obstruction, air trapping, shortness of breath, and frequent infections that leads to abnormal ventilation perfusion ratio, hypoxemia, hypoventilation, and cor pulmonale. Just like chronic bronchitis, emphysema caused from tobacco smoke and air pollution that can have alpha-1 antitrypsin deficiency, breakdown of elastin in connective tissues of lungs that can lead you to emphysema, destruction of alveolar septa, and airway instability. And just like chronic bronchitis, the symptoms are airway obstruction, air trapping, shortness of breath, and frequent infection that will lead you to abnormal ventilation perfusion ratio, hypoxemia, hypoventilation, and cor pulmonale. And that's all for respiratory disorders and their pathophysiology.